Hello and welcome to the Alder Hey Emergency Department. This is an induction programme for the Year 4 medical students on their emergency department placement. The objectives of this video are to introduce the emergency department to you, to describe the layout and flow, and some tips about getting the most of your day. It also has some information about what to complete in your portfolio. The Alder Hey Emergency Department is the busiest children's emergency department in the country, and we see on average 180 to 200 children per day. We are a major trauma centre and we see a wide variety of emergency and urgent presentations in all children up to the age of 16 years old. The emergency department is busy, it's unpredictable, and if you have any difficulties or queries, then please ask any of us and we'll do our best to help. We really hope you enjoy your time with us. So what is emergency medicine? Emergency medicine is the medical specialty concerned with the care of illnesses or injuries requiring immediate medical attention. Emergency physicians, they continuously learn to care for unscheduled and undifferentiated patients of all ages. It's a dynamic and unpredictable specialty, and no 2 days are the same. It's a challenging specialty, and emergency medicine doctors need to have the clinical skills to carry out emergency procedures which maximise a patient's chance of recovery or survival, and they can often have limited information about a patient before starting that treatment. The two links below are about further information about becoming an emergency medicine doctor and a career in emergency medicine. So please check them out when you have time. We are a multidisciplinary team. There are consultants, trainees, advanced nurse practitioners, emergency nurse practitioners, senior nurses, healthcare assistants, play specialists, receptionists, housekeepers, domestic porters, all located in one area of the hospital. We work closely together and we work closely with other specialties in the hospital to deliver care to our patients. This is the consultant group. You'll see us around on the shop floor. Consultants in the emergency department are present from 8 o'clock in the morning till 12 midnight every single day of the week. And we provide leadership and expertise to the team in the emergency department. The emergency department is the front door of a multi-specialty hospital. We provide high quality care for our patients who may have presented by themselves through their own transport means, or they could be primary care referrals from their GPs or walk-in centres, or they could be transfers from other hospitals around the region and beyond. We are active in research, audit and teaching, and hopefully you'll see this during your time here. This is where we're located. We are located kind of diagonally opposite to the Institute on the Eton Road entrance to the hospital. And now we're going to talk about layout and flow. This is a schematic representation of the emergency department. You enter the emergency department through the main entrance from the Eton Road entrance. This will take you into a waiting room. You'll need your pass to be able to enter the clinical areas of the emergency department proper. You can also enter the emergency department through the main atrium of leading to radiology waiting room, which leads into our department through a subwait area. Again, you'll need your pass to enter the clinical areas. The hub, or the ED hub, is located in the centre of the emergency department. It is surrounded by clinical rooms, and this is where the consultant in charge, the nurses in charge, and the majority of the clinicians will sit and document. This is where the 12 o'clock teaching will happen and where the huddles will happen. To enter the office or the training room or the changing rooms, which are, as you can see on the left of your screen, please do not go through the resus routes. Please enter the non-clinical corridors to go around the clinical areas. You will need your pass for entry to the changing rooms, the toilets, the office and the training room. The training room is where you'll be doing your reflection into your portfolio at the end of the day. So patients will arrive in the emergency department through the emergency department entrance. They are then screened by a senior nurse or a consultant at the front door. And there are kind of several options that can happen to a patient from that point. They can either be streamed to the urgent care centre, which is located outside and to the left of the ambulance bay, where urgent care members of staff are present, including GPs and a minor injury stream. Or they can be taken through to triage and have a formal triage assessment in the emergency department. Or if very sick or needing isolation, or they have a clinical condition which requires to be seen immediately, then they will be taken straight through into our resus area or into another room in the emergency department as deemed necessary. After triage, and if the patient is deemed appropriate to be seen by the emergency department and emergency medicine clinicians, they will wait in our waiting room. And at that point, they will be seen by emergency medicine clinicians in the emergency department. Most of our children will be given a clinical diagnosis without the need for further investigations. However, the clinician can decide to do further investigations for the child, might observe the child or refer the child for admission, or on some occasions the child can go straight to theatre, or a combination of all of them, or none of them. It depends on the clinical information of the patient at the time. If a patient isn't admitted, then they can be allowed to go home to their own home, but they can also potentially have a prescription that they need to pick up from pharmacy, or go home to reattend a clinic. And there are a variety of different clinics that the emergency department has access to and that we can refer into. These are all things that you'll see on the day. The next series of videos show a little tour of the emergency department, and I'll point out some important information. So this is the emergency department entrance, and patients will come through this entrance and will be greeted by, first of all, some important information. For example, you can see the measles alert. There's some information about travel and high-risk areas. The streaming nurse will greet the patient and ask the patient and the family what the issue is in order to be able to allocate that patient to the most appropriate service.
If you just make your way over to reception just to check in for us.
It's important for our patients to be registered on our system. That way we can track the number of patients who arrive in our emergency department, and also for safeguarding reasons, and also to be able to document on our patients. We are an electronic department, so all our notes and prescribing and ordering of investigations are all done electronically. Now a patient has been logged onto our system. The patient is then brought forward to triage if they have not been streamed to the urgent care centre. Triage is a process which is a preliminary assessment of patients in order to determine the urgency of their need and the urgency and nature of the treatment that is required. We follow a modified paediatric triage system, which determines a little bit of information about the patient, some observations on the patient, and there are some various checklists that need to happen in order to understand the urgency of the patient. For example, if a patient triggers the sepsis pathways, or if a patient is immunocompromised, or if a patient has any safeguarding triggers. These are recorded in the triage process, and a level of urgency is then allocated to the patient in terms of waiting time to be seen. You will see this when you do your observation.
Hello, come in and take a seat and I'll just check your observations.
Also in link is some information about triage, and that's in the second presentation. Once a patient has been allocated their urgency and it is time for them to be seen, they are taken to their room. You will need a pass to enter the emergency department proper.
If you come with me and I'll take you to the room, okay?
These are the non-clinical corridors. They go around the emergency department. The clinical areas of the emergency department are behind the yellow wall. You can enter the emergency department through this area or through the area next to triage. That's the nurses' station ahead of us. And this is a typical patient room.
Take a seat, one of the doctors will be with you soon, okay?
This is now the ambulance entrance. This is this is the ambulance bay. Ambulances will come to the emergency department through a separate entrance. They will park up here and they will enter the emergency department in a specific door. Going through the ambulance entrance, we enter what we call the hot corridor. This ambulance entrance will take the patient straight to resus, or if they do not require resus, there is a corridor to the left which the patient that you've just seen, that yellow long corridor, which the patient can enter the emergency department as well. The male changing rooms are on the right. You will need a pass to enter this. On the left, just passing there, that's that long yellow corridor. On the right is the female changing spaces. There are 2 resus rooms, and that's what they look like. Opposite resus is the training room, and that's where you will be doing your portfolio reflection at the end of your shift. So that's the ambulance entrance, and this is the same corridor that we walked from triage. This is the 136 room. Patients will come in here if they are placed on a section 136 for their own safety and for the safety of others. This is that same door that we entered the department with the nurses station. HD and resus are on the right, and the standard clinical rooms are as you can see. These are other areas of the emergency department. So this is a minor ops room, which minor procedures are performed, usually under procedural sedation, for example, ketamine. If one happens while you are there in the department, please ask the consultant in charge if you are able to observe the procedure. This is the ED hub. This is where you will be going at the start of your shift to introduce yourself to the consultant in charge. Other areas of the emergency department, just utility, that's the medicine prep room. In the medicine prep room is an Omnicell where we have access to prescribed medications. There are cannula and blood taking equipment, and we have a blood gas machine and a pod. Now, further down the emergency department, we have another nurses station, the other wing. There's a small subweight area there, and to our left, around there, that is triage. So we've come through that door, and that non-clinical corridor is to the left through those first set of double doors. So there are two entrances to the clinical areas of the emergency department from that side of the hospital. Moving forward in the emergency department, that's the subweight area. There are more rooms up there, all the way up to resus. And this is the entrance to the main atrium of the hospital, past the eye room, double doors. You need a security button to press through. Outside here is another small waiting area, and that is radiology and the main atrium of the hospital. We have a sensory room where patients who have difficulty waiting in the main waiting area can wait. There's a patient toilet next to it as well. Following the caterpillar, we now enter a non-clinical corridor. This takes us round back to the triage area. We have a well-being room for a little bit of quiet time or a little bit of reflection should we need it. Going through these doors, you will see that that's the long corridor, non-clinical corridor, that's back into the emergency department, and that's back out to the main waiting room and triage. It's kind of one big rectangle. Okay, so how do you get the most out of your time with us? The key is in preparation, observing, and reflecting on what has happened. Preparation is read through the information expected of you before starting the shift. If you're not able to do this, then you won't be able to do your shift. It just won't be worthwhile your time unless you've prepared in advance. So you do this by watching this video and part 2. There is some written information as well that will help guide you on what to write in your portfolio. There is a portfolio reflection expected of you after the end of this shift. Preparation. Okay, so what to wear? You wear your scrubs. We are bare below the elbows. It's a clinical environment, and hair is tied back, and there are no ties or long necklaces or earrings that could potentially dangle into a patient. There are lots of hand washing stations and hand gelling stations, and it's really important to maintain hand hygiene while you're in the emergency department. We wear masks and aprons if the patient has a respiratory complaint, and that's to protect us and our patients. On entering the emergency department at the start of your shift, please go to the emergency department hub, and there's a sign-in sheet that you will need to sign into your shift. You will need to sign out after you finish as well at the end of the day, and please introduce yourself to the consultant in charge. The consultant in charge will then do the huddle, the 1 o'clock huddle, and you will see how management of the emergency department starts. After that, you will then start shadowing a clinician to see some patients. There is a break scheduled as well, so please take your break. and take the opportunity to talk to your patients. That's a really important step. And under supervision, you can examine. The next slide is a schedule. This is the schedule of your time in the emergency department. At 12 o'clock to 12:10, please sign in the sign-in sheet in the hub and attend the 10-minute teaching, which is also in the hub. At 12:10 to 1 o'clock is a working lunch. You're watching this video, you're watching a part 2 video, and you're reading what is the requirements for you to enter onto your portfolio, a guide. 1 o'clock to 4 o'clock, you do some shadowing, which is in the emergency department. And 4 o'clock to approximately 5:30, you watch handover of the department. There's consultant handover at 4 o'clock to 4:30, and then there's department handover at 5:15 to 5:30. At 5:30 to 6 o'clock, you take a break. 6:30 to 8 o'clock, you continue your shadowing, and at 8 o'clock to 9 o'clock in the evening, you complete the reflection and your portfolio entry. That's in the ED training room, which is opposite recess. And at 9 o'clock, you sign out and you say bye to the consultant in charge so that they know that you've left the building. Any issues with that schedule, then please speak to the undergraduate office. So you're here to observe what we do and to see how the department operates, to give you an idea of what emergency medicine is about. You won't be expected to see patients independently, prescribe or dispense medications. And under direct supervision, you may be offered to assist with certain aspects of care of a child, for example, distraction or anything like that. We do encourage you to talk to your patients and to talk to their families about their experiences and what they've presented with to the emergency department, but please do not give advice to patients and their families about healthcare matters. Please redirect these questions to the clinical staff. So your placement will actually start at the front door. Your observation part will start at the front door. You need to experience streaming and triage. When you're sitting in triage, please choose your patient from that triage time. Ask permission from the parent and the child if you can shadow their time in the emergency department. You need to take it in turns to be in triage. Sometimes we have only one triage that is open. Other times when it's busy, we have 2 or 3 triages that are open, and you can all sit in one of those areas. It's important that all of you are not located in the triage area. It's a small area, and sometimes that can overwhelm the child and the parent. For your portfolio, you'll need to have followed one patient through the department and see every interaction. You don't have to be with the patient the whole time, but you do have to see every interaction. And this is the patient journey. At other times, you can observe and shadow other patients. The more you see what happens with different presentations to the emergency department, the more you will learn from the placement. For very sick patients or very specific patients, for example, immunocompromised patients or safeguarding cases or mental health presentations, please ask the clinician or the consultant in charge if it's appropriate for you to observe their care. So you're going to be observing the streaming process, the triage process. You're going to be examining how the clinician takes a history and examination. You're going to be observing and understanding the decision-making process and how to formulate a differential diagnosis. It's a really, really important part of emergency medicine. You will be observing any investigations if necessary. If a patient has to go to ultrasound or has some bloods taken or goes to X-ray, then please follow them through that journey and see what happens. Specifically in emergency medicine, you need to observe what happens to our approach to pain management. How do we assess pain? How do we address pain? And how do we ensure that pain is relieved? There's also a safeguarding. Safeguarding is everyone's business, and we have a lot of safeguarding presentations, and a lot of children have safeguarding issues when they come to the emergency department, and it's important for you to understand how clinicians deal with that. And then you can understand the flow through the department for your patient, particularly with waiting times and with communication about what is going to happen to them. Your reflection will include the method and impact of triage on your patient, the history taking and the examination methodology, and the diagnostic approach in the undifferentiated patient. It will also include something about pain management if appropriate and the safeguarding screening. Your portfolio entry will be a reflection pro forma on your e-portfolio. This is based on the case that is seen and followed through the emergency department. The reflection is then reviewed with other entries of your paediatric placement and assessed by your educational supervisor. Okay, so in summary, we really hope you enjoy your placement with us. Please take the opportunities as and when they come. And please speak to your supervisor or the consultant in charge if you have any issues. Thank you very much. Now you have to watch part 2.